Hello and welcome to the YouTube live session on data analysis, modeling and forecasting of COVID-19. This is Gunjan and your host for this webinar. So what exactly is COVID-19? Probably this is a weird question to ask since most of the people who are watching this video already know the purpose behind this webinar and they know what exactly is the impact created due to COVID-19. So rather than going into exact details, what COVID-19 is, etc., I would like to start with some introduction of basic background of COVID-19. Let me share my screen and then we will discuss about it along with the presentation I have made for you guys to see. All right, so I hope the screen is visible. COVID-19 tracking with MATLAB Helper, which is the theme of this webinar. The learning objective of this webinar is directly to make the awareness of COVID-19, what exactly is happening in the world due to COVID-19, how exactly this is creating a havoc in the our world, and obviously the MATLAB. Our organization MATLAB Helper has a mission which is to develop next generation of technology developers. We have already built a couple of applications and have uploaded it on MathWorks File Exchange. I'll be discussing about that as well as we progress our discussion. But before that, let me introduce about COVID-19. The disease was identified first in December 2019 in Wuhan, city of Hubei province of China. Since it was identified in 2019, WHO have to give it a standard name. The name which was given to this disease was coronavirus disease 2019, and in short form, COVID-19. COVID-19 is an infectious disease caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. WHO declared it as a public health emergency of international concern on 30th January, and they declared it as a pandemic on they declared it as a pandemic on 11th March. As per the data, we have till 24th April, 2.79 million cases are there worldwide who have been impacted with the coronavirus disease. And the cases which have resulted into fatality, that is death, it's 1,95,000. This is a very big number and we don't have a solution yet for the problem. Talking about the symptoms. So the most common symptoms, and I'll talk about the main three which are being shown over in the presentation over here, is fever. Like 88% of the participant who the cases have seen the symptoms of fever, dry cough and fatigue. These three are the main symptoms, and there are some uncommon symptoms as well. So the cases of coronavirus are divided into symptomatic, the top three, and asymptomatic cases as well. People are most of the cases in US, for example, are asymptomatic cases. And it is very good. The number of testing which they have done has resulted into the early detection, even though the number is very big, but it is spreading an awareness about what is the impact it has already created. The severe disease situation can cause difficulty in waking up, confusion, blue face or lips, coughing up blood, persistent chest pain, decreased white blood cell, kidney failure, and high fever. So what exactly is the prevention method being utilized by the countries, and how data makes an important part of this prevention strategy? During the COVID-19 stage, in the early breakdown, when it happened, for example, during December, January, and let's say early part of February, the number was quite stacked towards China, Hong Kong, and nearby countries, for example. The population which left Wuhan, they visited several countries. People got this disease through the travel history of other people's, and ultimately it resulted into cases being spread from one country to another. And then today more than 185 countries and around 205 international territories are being impacted with this impact. So when we talk about this prevention strategy, isolation and quarantine are the main principal methodology which are suggested by the countries. So when the step-by-step increment of this COVID-19 was detected, isolation And the quarantine was a strategy deployed by a lot of countries, including China, and this resulted into a very good number, which got this thing. As of right now, when this presentation was made, and there were more than 228 lakh 30,000 cases which were there. 28 lakh and 30,000 cases were there of COVID-19 disease. In India, this figure is almost 24,447 in the morning when it was updated last. When I'm talking about this prevention strategy, as we have decreased the number of cases on a daily increment wise, the curve is downwards, slope is downwards, and it is under the capacity of the healthcare system. So the number of people who are getting infected with the disease is the number should be around the number of the people who are getting recovered also. By doing this, we can get the number reduced and the situation or the impact of the disease can be decreased. However, for example, in India, the lockdown, which was supposed to end on 14th of April, it got extended till 3rd May. And it might even be extended, which it could be anything. It can be extended, it cannot be extended, depending upon what government decide. The reason for that is effect of inadequate medication, mitigation of the strategy. That is a second wave which can happen using the resurgence of the cases. What I would like to begin with this webinar is related to analysis. Then I'll be talking about the modeling. And finally, the discussion would be related to the forecasting. I am currently into this webinar. I'm currently holding this webinar through home since the office is under lockdown. I don't have a lot of resources. So people who want to have their queries, they can simply post it either on the website discussion section, or they can comment on the YouTube webinar video, and I'll try to respond back to the queries as much as possible live, which you guys might have. I have also uploaded the 2 applications which I have built as of yesterday onto the MathWorks file exchange. You can simply use this link and go for the downloading part. I'm showing you this as an example also. COVID-19 tracker with MATLAB. So this is one of the app which has been built. You can simply download the app and test yourself what I have built. It will be helpful for you during the course of this webinar, since it will be easier for you to do the same thing which I am also doing simultaneously. If you want to download this presentation has also been uploaded, and I'll be showing the steps to do the downloading of this. Go to the website, download resources. Over here, you have all 3 methods: download app, presentation. The presentation which I'm using has been uploaded in the link is http://mlsp.link/live-covid9. Let's begin our discussion with respect to analysis. So the data makes an important point how we can do all these analysis. For the global detection and the performance analysis, I have been using ECDC Europa for all their country-wise data statistics with respect to confirmed cases, confirmed deaths, daily wise, for continent wise, country wise, etc. You can simply download the data from here. I am doing it right now in front of you so that I can use the current live data during this webinar part. Let me also add this data directly to the folder where I'll be working on this application. As you can notice, like I have been trying to improve this application on a regular basis. So the information which I might have shown earlier can be outdated, and even after this webinar, I'll try to create the revision of application, and I'll be, since I'm already sharing it with a lot of people, I expect that you guys will also help and contribute in improving the application. Let me share the MATLAB screen. This application and ECDC Europe data, let me use the data of ECDC Europa and analyze it for continent-wise information. As you can see, it is taking some amount of time. This amount of time was required for conversion of the Excel data into a MAT file, which will expedite our processing in the later run of time. Example, and we will be discussing it in depth in few minutes. You will see the figure. This figure contains information of the total cases of each continent versus state. As per ECDC, they have taken both North America and South America as a single continent. So America over here is representing both North and South America. You will be noticing the number of cases from March 27th till today and currently during this time of the webinar. Now, how exactly have I done that? This is gonna be discussed during the modeling part. But if we talk about simply our data source, how from, if you are not relying on just ECDC Europa, there are several other resources which you can utilize for the data. For example, through Wikipedia as well, you can have the data set. John Hopkins University has a good map to see what is the current live data set. HDX is another source through which you can download the dataset provided by different portals. Wordometer is again a very good portal on which the data is being provided. I'll show the latest figure through this while opening on my website on my browser. So right now the total cases which are being shown are 28 lakh and 50,000 approximate figure. Another number, another important resources is WHO. If you know how to process the data from PDF and all the information, you can obviously take reference of WHO and do this processing. If you don't want to use the data of Word, and if you want to dedicate this application specifically for India, COVID19india.org is a very good website for that. Let me open and show the data set through that as well for the reference. So this data was last updated at 4:17 p.m. on 25th April, and the current figure are being shown. This figure was for the overall country. And if you want to get individual data, for example, you want to get the raw data of all those 24,000 plus cases, you can download the CSV from this website mentioned. In one of my code, in one of my application as well, I am using this data of case time series as well as state-wise data for the reference of showing a table structure of how many cases are there for each state within India. If you want to identify how many tests have happened, you can utilize the data from ICR, which is the Model Agency of India about this epidemic. Other than this, even you can rely on the data sources of Wikipedia, Ministry of Health, Family and Welfare. And if you want to individually check out the data from the state portals, you can go through the website mentioned and utilize the information. So moving from the data sources to the part how the data is actually received or taken up into MATLAB. We have three methods through which it can be done. One is Excel file. So for Excel file, I shown you that I downloaded the data of COVID-19 through ECDC Europa. Now, if I have downloaded the data of ECDC, what you can do, and let me show you from the scratch part so that you can also follow the same steps. You have uploaded the COVID-19 file in your folder where you want to utilize the data. You go into your home, click on import data. This will ask you which file you would like to use for the data importing. I'm using geographic distribution worldwide, this which I have downloaded right now. Now we have this option of import selection through which either I can directly load the data, that is using import data. I can generate a live script or simple script, or even generate a function and utilize this information into this part. Over this thing, a step I would like to show you, which is an important step. Now, what will happen on a daily basis? Then, since there will be new entries in the Excel file, since the date will increase, you need to make sure that your data, you create a single function, but it download the data of all the rows without need to change anything particularly. How this thing can be done? Let's talk about that. Within the MATLAB, you have the function of reading the table directly. This read table functionalities will detect how many rows are existing. Now the first row is always for our header. So the data or the number of rows which we are going to have is rows plus 1. And this I have actually used up in my application concept. This function over here took workbook file as a source. The workbook file was a single value. That is the path through which I am downloading this information. So COVID-19 geographic distribution, the name of the file will be the workbook file, and it will remain same for me. So I did remove this parameter. Then sheet name, again, the sheet which they are using up in the ECDC generated portal is staying same. So I'm using that part again same with the name of this part. And finally, the range, which gets changed every day due to the change of data. This we are doing along with the process of rows finding out this thing information. Later, these data are divided into several subcategories. For example, we started with the information of date. So if you talk about this information of date wrap, which is indicating all the dates from the first day of origin. For example, the first country which it's showing is Afghanistan, and it has data till 25th April, that is right now, which I'm expecting this live session. And their data of Afghanistan is starting through almost 30th December, it looks like the 31st December. So the numbers they have, this is something which we are going to use date wrap. We are not going to use day, month, and year, since we already have this information through date wrap variable. Cases and deaths are the two variables which are daily number of cases and daily number of deaths. Geographical ID is for distinguishing between the countries. Country and territory information is another important part. And population data, which is they have recorded as a single value, and they have taken the data till 2018 only into the picture. So then this number can be wrong as well. Now, when we are talking about this data set, once the data has been loaded, we are saving it as a MAT file. The reason we are doing conversion of the data from Excel to a MAT file is it will allow us to load the file directly through the MAT variable. And it also saves the time in loading Excel and doing all the processing. At any moment, if any of you have any query, I'll request you to post it either on the comment section on website, or you can also post it directly on the YouTube comment section. I'll try to take up the same point again and help you out if you guys are missing out the step taken by me. And for those who have already downloaded this application and they have tried it in their system, it will be very wise to try it out while I'm also explaining it, so that I can take up as many queries you guys might be having for this webinar. One information was related to the Excel and another was with the MET, third point. Now, second point is web read. You can also fetch the data directly from the source. For that, I wish to see you, I wish to show you the code for example, let's say we do the data of Indian state. We can simply do that using passing what this URL. We can use the web read function. To show this thing, let me delete the met file whichever have been created except ECDC, since it has been created at this moment only. And I would run this program step by step wise to show you what's exactly is happening. Since the file is not existing, it goes into the else part directly. We display that it will fetch the data from internet. We pass the URL, which is the covid19india.org, and the link is shown. And we use the web read function. This data is stored into state-wise variable, and later this variable is stored as a met file. Now we have this data into our workspace. If you notice that through the workspace, there were several variables over here from total, like all the state information, confirmed cases, recovered cases, death, active cases, when was the information updated last, change of confirmed cases, change of recovery, change of death, etc. So this was the method in which you can utilize WebRead to fetch the data from CSV. We could have done the same step from ECDC Europa also, and it is not necessary that you only do the processing through CSV. There could be, they are also providing the format, for example, XML, JSON, etc. And if you know how to process the data even into these format, like how do you convert those fetched data into your usable data, you can easily do that. But for those who doesn't know this intensively, the best and simplest way is download the data in Excel or CSV file, use the import tool in MATLAB, declare what the variable name is, and import the data in your MATLAB. The easiest step is this only. So we have talked about the importing data in MATLAB. Now let's talk about using the data in Workspace for data visualization. For this, I'll be using the data of India specifically so that it will be easier for you to interpret it. This can be done for other countries as well, and it will be helpful for you when you review it for your data set. Let me quit the program. Just repeating that process ECDC Europa, this file is already available and I have shared it. You guys can download it and run it along with me while I'm also working on it. And now talking about the data set of visualization through our workspace. Let's take an example through Process India case time series. Over here, in my left side, you will see the current folder on the screen. It doesn't have a met file for case time series data. So when I'll run this program, it will obviously fetch the data from internet so that it will be having the latest information. I want this data to be fetched and go up to this information so that I can manually assign that date, daily confirmed cases, total confirmed cases, daily recovered cases, etc. information to individual variables. I'm running it. We have this information on our workspace now. So if you have the data in your workspace, you can utilize workspace directly for observing or plotting them. For example, I have date along with daily confirmed cases. If I use the plot function over here, and it will simply show the figure from the starting date till the current information. If you're talking about daily cases with the daily deceased person, same way you can use the plot function. And you can see over here the plot for the diseased people over here. It's if you want to use the plots tab under the MATLAB, you can simply go and choose the variable in your workspace and simply click on the different variables. the pattern on which it can be used for the plotting purpose. If I use this as a daily date versus total confirmed cases, same way I can use the plot function area bar scatter, and the example goes on. It's not just limited to two number. For example, you can have choose multiple variable date. I'm choosing daily recovery and total recovery, and then I can use plot as multiple, and the multiple plots are being plotted against the date. If you are talking with respect to the, let's say we choose daily confirmed cases versus total confirmed cases, this can also happen using the plot. So number of daily cases of increment and in which way it is reaching to the total confirmed cases at the current moment. One of the good plotting pattern is Comet, which you would like to observe, as it shows an animated number, how it is progressing on a regular basis. So I have shown it, plot, area, bar, scatter, and there are multiple other patterns in which this can be discussed or this can be talked about. Now talking about the global COVID-19 tracking with ECDC Europa. Specifically, we have 5 main resources in this Excel file: continent, country, daily confirmed case, daily death, and population as on 2018. If we had the data of daily recovery, I would have said that this is the best data set for you to use for processing. But still, I think they have a scope of improvement uh, in terms of adding daily recovery in their data set as well. Now, I'll just run this process ECDC Europa completely. What I have done in this code is, first I have shown or I have fetched the data for individual continent. Let's say you started from Africa, America, Asia, Europe, Oceania, and others. Others over here could be some international territory, for example, cruise ship, etc., which have these COVID-19 cases, but are not necessarily into a continent category. So we use this information from MATLAB and given the total number of cases, it is easier for us to say that the number of cases within Africa and the cases within Oceania, that is Australia, New Zealand, and around that area, is very low. And that's a very good sign that they haven't seen much of the cases. It's again a worrying matter that it might happen. The number is low at this moment. Maybe the testing number are low. Maybe some information is yet to be updated. But the total cases for America itself and Europe is too much, is too high, and um, individually, if say it's around 10 lakh or 11 lakh reached into that figure. Cases for Asia is around 4.4 lakh. When we observe these data, if I put 0 as a figure, it will show the plot for entire, that is from beginning till now. Let me maximize this figure. So over here, you will be observing the plot is only showing 5 continents. I have excluded others in this so that I can only talk about the main continent. The figures initially, when the epidemic was at its initial stage, the number was panicking too much. So on this particular date, for example, around mid-Feb, I think it's around 12th or 4th, around 15th Feb, the number of cases which were detected in China, the way they were considering the number of cases, they changed their policy, and suddenly 15,000 cases were detected, suggested like the number is that. Post that, this curve over here is of Asia, and the number has not been increasing that much as compared to the number which we will be seeing above for Europe and America. The number of cases for Africa and Oceania are very marginal as compared to this figure. Just like this, when we are seeing the plot of daily death, this number of death within Europe is too high. Even in America, the death number are very high. Asia's number is still into the low zone comparatively as compared to the numbers of Africa and America. If we discuss about this change of number in sudden date. On 17th April, China again revised their number, their figure, by adding some of the cases which they did not added earlier. So that information was also can be observed easily through these plots. These sudden spikes are something which we should be worrying about. Sudden spikes can create an issue. For example, there are sudden increment in the number of cases which are being observed. Okay, so when we are going to discuss about this application, before that, I am doing the comparative analysis between some of the countries. So if we do the comparison between China and Italy, you will be observing that the cases in China, which is individually on the left side, and then China versus Italy. Earlier, the cases were high for China. The numbers were very low in the end. It's almost they are having around less than 100 cases each day, and those are also with the travel history only, like people who are coming from outside China. And the China's case number, that is total confirmed cases, is almost constant in the later part. When we compare it with the Italy, you will be observing that the China's case number of the has been almost constant and Italy's number is continuously increasing. When we see this third figure over here, the subplot number 3, it is talking about the increment cases, the percentage wise, how much percentage increment has happened on a comparative basis from the earlier cases. This is a very big number, almost 500% cases increased in the suddenly during early part of March. That was again the region where Italy became in news too much due to this sudden spike of the numbers. And if you want to see it, observe it using MATLAB, let me show it to you. China, I'm entering the name of the country, and then I'll put the name of country Italy for this comparison. Over the presentation, the figure is for almost last 80 days as per my assumption. But in this figure over here, you would be clearly seeing that the information is for almost all the period. All right. If we do this analysis continuously, and if we take reference from other countries also, so I'll show with respect to the country wise, Italy versus Spain for these analysis. I'll rerun the program. This time I would try to see the analysis for 60 days, and we will do the analysis between Italy and Spain. Figure 1, which is continent versus date, is also now only for 60 days as we put into this information. Comparative analysis between Italy versus China will be showing you that the numbers of cases which were incrementing in Italy was high in the earlier part. Then the number of cases came up in Spain. Suddenly they have total number of cases, they have gone higher with comparison to the Italy for Spain. Even if we talk about the figure of death figure as well, that the death figure is equivalent for the two countries. However, comparatively analysis for the two countries says the number of increment, the percentage wise increment of daily cases for Spain is too high during this March pattern. Even though the percentage increment of the daily cases was high for Italy, it was even higher for Spain, which can be observed over here. I'll quickly show through the other comparison, which I have already added on the presentation. You guys can download the application through the MathWorks file exchange. If you have any queries within this part, you can post it on the comment section within YouTube, or you can also post it on the website discussion section, and I'll take up all your queries at the end. Comparison between United Kingdom and United States of America. Comparison between
US and India. Between India and Pakistan. Between Pakistan and Iran. So now we will be going with the application. We designed this application of COVID-19. We want to design this app from scratch. We
A lot of time, and it would not be possible to cover up everything, including analysis, modeling, as well as forecasting into this entire period of about 1 to 2 hours of this webinar. So to do that, what I have done is I have already designed this application, and I'll show the application's functionalities to you. This application has also been uploaded on the MathWorks file exchange, and you guys can download this app and try it out. I hope the queries which you guys would be having is really interesting, so that it will help me in improving the application even further. When I run this application, I am using two dataset, ECDC as well as for COVID-19 India information. Let me run this application for the first, and then I'll talk about the individual component which I am using in this application. All right, so by default, we start with the country India, but we can simply change it to a different country as well. For example, let's change it to Australia. If we change this figure as well, figure changes as well at the same time. So you will be seeing that total cases and total death at the same time. I can reset, and if I want to see upload between different curves, for example, I want to see total cases, total death, and a plot. So with respect to the total cases, how many deaths have happened, it can be observed. If you want to compare it with respect to the last set of few days, you can change this number over here. How many days has happened? You will be observing it over here. Let me reset it and show it with respect to date versus daily death. The number has again, I'm currently showing it for Australia. This is covering up entire amount of data from from December 2019 till currently. If I want to see observe the data for, let's say, last 30 days only, so I've changed the days period over here. Day by day, how many deaths have happened? So let's say on March 27th, 2 deaths were seen in Australia, and recently about 4 deaths have been seen in Australia. This number is too low. Let's take it to a number which is more suitable and can be compared with the information you guys would already be knowing about. So let's take the example of China itself. If you take the example of China, you will see the total number of cases they are almost at a very they have almost flattened their curve. Total death as well. I'm resetting this information, and now I wish to observe the plot between date and daily death. The spike of number was obviously or recently on 17th of April. If you compare it with the last 30 days, for example, the information is too minuscule. We have other kind of plots as well for observation purpose. For example, stem plot, stairs plot. If I show you the data for other country, let's take Germany as an example. I'll reset it and I'll plot a scatter plot between date and daily death. If I want to observe it for last 30 days again, this is the figure over here. Using the plot part, The death figure in last 30 days is almost between 50 to 300, almost 300. We can show an area plot, bar plot, scatter plot. We can also use a logarithmic scale to analyze this information. For example, I'm using the logarithmic scale on my y-axis, on which the way this increment is happening. This is more suitable when you are doing the analysis between date and, let's say, total cases, and then you use semilog y. So you would see the way of increment which is happening from date. So the number of figures which were into 10 raised to 1 range initially spiked to 10 raised to 2 within few days, 10 raised to 3 in again few days, and now reaching into the way of recovery mode. Let me take an example of some other country for reference now. Let me take the United Kingdom. And now this is showing the statistics of United Kingdom, date versus total cases and total death. If I show you the plot, this information can be observed. What I have done in this application, I'll be discussing in it. I see that Nitin has raised a query. Can we save the plot graph in image format? Yes, Nitin, we can simply use the IMWrite function. Like, I haven't added the functionality of IMWrite, but if you want, that can also be done. For example, I'll simply add a button, push button over here. And let me click on save. We can add a code to that. We have the information of UI access. So what we can do is we can use IMWrite. We can use the figure information from GCA. If you don't know exactly about this thing, MathWorks documentation is very helpful in this situation, where you can simply refer how you will be able to use IMWrite, like what are the variables which are required to be passed in that. We need to pass the, sorry, I have written IMWrite as IM wrong. There are two ways in which you can save the image, using IMWrite and using save. You can use GCA also to save this thing, and you can also save the data through directly this IMWrite function. If we are talking about saving portion of this image as well, over here in the analysis part over here, since I'm using MATLAB R2020A, there are multiple portions also where I'm simply able to do this movement and all kind of structure. And coming to your queries of IMWrite, obviously we need to fetch the data from the axis. So this can be done using GCA, which currently takes the entire information, or GCF with respect to the current figure. This information of GCF will be taken from the figure, and we can use this figure to be saved using the IMWrite function. In the worst case scenario, you can simply use GROOT for the current figure estimation. Whatever the current figure is, it takes that into the information and use this to plot the information. All right. Coming back to our model of this program. Next, we are going to talk about the days, how exactly the days are being modeled into this picture. When I created this application, I felt like for most of the countries in initial period, that is from December till early stage of March, the data was very minute and it wasn't creating any of the essence to even review those data. So rather than reviewing those information for that period, we wished to create this for some specific set of data from the current date. In doing this, what we can do, or what we could have established, was this only take the last amount of data according to that. I'll show you this information even during the callback. I have created a function to model data whenever this day slider value is changed. And this model data actually takes the value of how many days they are choosing up over there. This part is exactly similar to what we did in process data part during our processing of ECDC in Europe information over here. This days part over here. Coming back to this part, the most important or crucial part of this program was how to choose which plot you are establishing depending upon the different information. We have different different selection of the plotting, whether we want to do a plot, area, bar, scatter, semilog in X, semilog in Y, or logarithmic in both the direction. Then stem, bar in horizontal, comet, stair, stack plot, etc. So what I did was I have created a logical structure in which if the information of X is selected, or if information of the X box is selected of date, it will only be possible for you to choose information of in number form. You can't choose again date in the while list. But if you have chosen anything else other than date in the X axis, for example, daily case, total case, daily death, or total death, then you will be able to choose the remaining three variables within your while list. So your while list over here will always be showing based on what you are choosing, total case, and then you can't choose the figure or choose this information in X or Y until you reset this information. And when you reset it, it by default takes it to the initial value. However, if someone chooses the value directly, like they simply don't want to choose this other value than date or daily death, but they want to choose area, for example. Even the plot should work in that direction. So for that, what we have added in the code is the position in which both X list box and Y list box are enabled. We by default take that date and daily death information. If the situation is such like if you have changed Y value, but you haven't changed the X value, in that situation, you will by default take the value from uh, date in the X axis. In both the situation, your values of C list box gets impacted. You enable the C list box, disable this first, plot it, and once the plot has happened, then you enable it again into this structure of the application. Let me show you this over here. For example, I change this to scatter. It changes the figure and keeps it as enable so that I can keep on changing the figure analysis over here. And I can keep doing it until I think like this graph is something which is more suitable to my stuff. One more point I would like to add at this point, since this is something you guys would have noticed when you work on it intensively, the country figure or the name of country in ECDC data contains underscore instead of space. So underscore when taken directly in a title will take it as a subscript. To remove that subscript part, what I have done in my program in the modeling part, that is where I am changing the plot every time, is simply remove the underscore, find out every underscore and change it. This has been done over here. Find out the underscore, change it to a white space and add it to the same part. So the value remains same or constant into that part. If we go ahead and if we talk about this in the intensity wise manner, let me change the country now and reflect it to India. And I would like to give you some observation which will be easy to interpret for the Indian people. Total cases and total death are being shown in this thing. Again, since recovery cases have not been given, the information of recovery has not been provided by ECDC, we haven't been able to create this information of adding. I personally want that recovery information should be added as much as possible to interpret the data in an intensive manner. And we'll be doing that once we get this kind of data. One person has asked, Siddharth has asked, can we create live real-time plot from web read data? Since the COVID-19 India ORG is updated on real-time basis, it is possible to create live plot. Yes, we can do the real-time plot. COVID-19 India updates the data in every 10 minutes. You can utilize the same data to update this information and update the figure. I haven't added this, like I didn't got much time to do this implementation, but I have done that in my MATLAB script. I'll show you. So we can do the analysis of data through the Indian information and then can plot it. Using the case time series information, for example, I run the data, how many days of data I wish to observe. Like if I add 30 days, I want to observe the data for. This will simply choose the data of the last 30 days through the latest case time series information and plot it. One another thing which can be easily done is if you have the mapping toolbox, you can use this real-time series data and observe, like along with the latitude and longitude value, you can show it on the plot on the map of the country through MATLAB as well. If you want to change the if you want to real time, when you're talking about the real time analysis, if your question was more into the pattern where you want to get the data exactly at this, which are being shown over here, I think this can be still done using the web read. You need to know how you can convert this information into a table format, but why you should actually work on this part rather than just simply fetch the data of 10 minutes delayed and simply get the CSV and do the analysis through that. That's my suggestion to you. All right, moving back to our ECDC part, um, we can simply see over here the cases of how many cases which have been happened over here for India. I want to observe what exactly is the scenario of daily cases versus total cases as a plot. If I observe this pattern, the daily cases in the initial part were low when the number total cases were low, obviously. And as the number of daily cases got increased, the total cases have also increased. This figure is something which is decreasing or increasing, but obviously it isn't exponential in nature. When we talk about exponential nature of cases, this plot would show you something more or less as an exponential nature of total cases. If there we add a parameter of total recovery, then that is a best estimation approach where total cases as well as recovery is taken into a factor and decided how that should impact the active cases in the graph. This is one of the scope of improvement in this application, and I would request all the developers who want to create something, an improved version of this should include the recovery part into the picture and make it with the active cases for the concerning related to this application. Since we don't have much time and we need to also talk about forecasting, I would like to quickly go ahead with terms of other application which has been done. For example, ICMR testing data. This is taking the data through ICMR, this COVID-19 website, and we are taking the data of tested number ICMR data CSV. They fetch the data through internet again, and this is showing the figure of total samples tested, total individual tested, and then total positive cases. One good observation from this thing is, even though the number of cases are increasing in India, the sampling or the individual being tested have increased very big. And if even with that number of cases, the real cases which are being detected is low, it feels like we are still not into the community transmission stage, that is the stage 3 of the transmission. And this is a very good sign for the country in terms of that we are into a proper correction phase. Even the country's healthcare facility has been increased and the numbers are trying to be improved. Moving ahead into the forecasting. For forecasting, I'll talk about three things. One, curve fitting. Second, SIR model. And third, SEIR model. For SIR model and SEIR model, I haven't implemented that yet in my application, since those were easily like I'll give some reference which are already implemented this thing, and you guys can download the application through that to observe the modeling. But I would like to talk about the curve fitting first, since this is something where easiest method someone will do. For curve fitting estimation, what I'm going to do is I'm again going to use the figure from case time series. Like I have actually already created this curve fitting script in the code. And I want to observe it in this pattern. We have taken the data from daily cases in terms of confirmed case, recovered case, and disease case, as well as total confirmed, recovered, and diseased cases. We can use this with the curve fitting toolbox. You can simply go into apps, use curve fitting. And in the curve fitting toolbox, you can put the information of days. One good point to add in it, if you want to run the curve fitting, you need to make sure that your application or what you have done is still in either have some variable into the workspace, or you have simply added the variables assigned this. Your program shouldn't be into the standstill stage. For example, it's still waiting for my action to go ahead. I'll simply quit the program at this stage, and I have the data, some of the data which I can show in this reference section over here. Going back into my curve fitting tools now, I'll use days. For days, we need to create the information like how many days has happened. So it will start from 1, and we will use the reference from how many days data we have. This is a date wrap variable. So we have about 1 to 86, I think, as the days data. I'll take this in my x-axis. And for y data, I'll start plotting for different cases. For example, total confirmed cases. Over here, you can change this from polynomial. If you go up, you will see the observation for exponential case. You can center and scale it. If you try to notice this figure over here, which has been generated, and let me maximize it for your reference, the figure of total confirmed cases versus days is still in exponential nature. But if I take it to number of 2 exponential terms, this part over here shows a sudden decline. I cannot claim it that this is something going to happen for sure from the next day. It might even be that this doesn't happen, but this is something which is going to happen over some span of time for sure. That number of cases will start decreasing. We have actually going to flatten the curve, or we are into the process of flattening the curve, and it is going to happen real soon. And to show you why I am saying that is, this part is, I would like to show you with the total recovery. If I try to compare total recovery with the terms of days, and if I use the number of terms, single number of terms in exponential nature, the curve is exponential and continuously increasing. Even if I change the terms to 2, it is still increasing. So total recovery is continuously increasing. It's not decreasing. However, the number of cases which are in the total confirmed cases, this is decreasing, and it is expected to flatten out pretty soon. Now, in order to make this prediction compare with what I have done earlier, I would like to take the data, a partial set of data. I started planning this around 21st March. So that was the first date on which I did this curve fitting curve estimation tool. I took the data from 1st till the 52nd. 52nd date is 21st March in this data set. I have already designed the code. So that is taking only the first 52 days for the reference of data. And if you see this over here, if you try to observe it with this part, for the first few days, that is the till 21st March, this figure, when the number was almost around 300 total cases, this figure was completely in exponential nature. Now, when the different newspapers and different portals shows the observation that this number is, this should have been the figure, we are still 10 times lesser than what it could have been before the lockdown. That is actually true. And I'll show you by plotting the information along with the next days and next T cases. All right. So when I run this model now, what you will be observing is I have taken this reference data till 21st March, used it as an expectation. What should have been the exponential curve, considering this is the pattern in which it followed continuously. However, the real curve which is happening is into this pattern of the lower pattern of original cases curve. Now the numbers aren't that high, which you will be observing with these two information. Curve fitting on 22nd of March was having the data set completely in the increasing part. On 24th April, that is till yesterday, and since I'm using the data, live data, so I can say the data till 25th April around 6 p.m. is into this pattern. If I try to compare it with respect to the prediction, the 1st April cases were expected to be around 1281. In originality, it happened 1834. On 14th April, it was estimated around 9,800. The reality was about 11,000 cases. On 22nd April, the estimation based on that model is around 60,000. On reality, we had about 20,000 cases. On 24th of April, estimation is 83,000, 25th, 26th, 27th. The estimation, my estimation was saying like it would have reached 1 lakh cases if we have reached to the, if we haven't done the lockdown by this date. But originally we are having 24,450 cases at this moment. What's wrong in this approach? Let's discuss about this now. There is an impact of lockdown. Earlier in this document, in this presentation, I have shown that the number of cases which are increasing, the spread of the disease could be stopped if we maintain, if we do some, if we take care of our hygiene, if we remain into lockdown with social distancing followed, etc. Just imagine this flattening the curve, this animation. You can, when you start observing this figure along with our MATLAB data, you would quickly observe that this quickening, this data of the higher version is somewhere matching with the curve of Italy. And this is my prediction that the flattening of curve is something which we are going to observe for India. It could happen that once lockdown gets open, there could be resurgence due to 1 or 2 asymptomatic cases getting open to the impacting our life cycle. However, there is a good amount of chance that we have increased our healthcare capacity, and we need to take factor out about the recovered cases and other parameter also. And a curve cannot be straight enough that if there are 500 people in a city, it doesn't mean that all 500 are going to be infected with disease. There will be few people who will also who are not going to impacted. Then there will be people who will be getting recovered. Then you have an R0 number which says like how many people you are going to impact, and ultimately what is the number of days, for example, in which this disease is going to improve upon, and you are going to the situation of you reach from infectious to recovery stage, which I'll be discussing ahead when I'm gonna talk about this SIR model. So what exactly is the COVID-19 transmission stage? Stage 1, travel history. For example, some in the country India, they didn't had the first case till 30th of January. Someone returned from Wuhan, and that was the first case that had a travel history. So that started this chain of reaction. Then local transmission happened. People who got infected with their connection to those people who are already having, who were infectious, are into stage 2. Stage 3 is a community transmission stage where we cannot trace when through which person or through which part you got this disease. This is a very stage in which most of the countries, for example, Italy or US, were when the sudden spike of number happened, where tracing of the disease or who was the source of this cannot be informed was happening. And stage 4 is epidemic, when everything is fails, complete healthcare has failed and nothing can be done. That situation is epidemic. Now I'll be talking about SIR model. SIR model is a very general and common model you will be seeing for the COVID. Even if you watch it on different YouTube videos, if you try to model for different diseases, there are several people who are talking about what exactly is an SIR model. That is susceptible, infected people, and recovered people. Let's assume that S of T is representing the total susceptible person, and in a reference, this would be all population. Infected person would be 1 or 2 or a small number of people who brought this infection in our vicinity. And then finally recovery, who in the beginning are 0. So we can simply design this into the format of ST plus I of T plus R of T is equal to N, where N represents the total population. At initial time period, that is at time 0, S is S0, which is almost the total population. I of 0 is I0, I naught, a very minute, very small number of population, and R of 0 is 0 at the initial period. What we need to discuss or what we need to take into factor is ds upon dt, that is rate of change of susceptible people with respect to time, then rate of change of infectious people with respect to time, and finally rate of change of recovered person with respect to time. I have done the solution for this over here. What happens? Some of the susceptible people come into contact with the infectious people, and then a proportionality factor A, let's take in consideration ASI, which is A is a proportionality factor, it will be in a small number, results into the infectious person. This means ASI is the number with which infectious people are increasing. This is the same number, but in the reverse, in which susceptible people are becoming infectious. So susceptible people are decreasing with an estimation of minus ASI, and infectious are increasing with the same rate. At the same time, some of the infectious people are getting recovered. We are taking an assumption, this SIR model takes an assumption that all the susceptible people over some time or over some period will get infected, and this recovery model takes into the picture that no new birth or death is happening, everyone is getting recovered. Even if death is occurring, for example, they will be considered it into recovery only, which is vital dynamics of SIR, that this thing over here is going to cover up the entire population. That's what the assumption of this SIR model is. In SIR model, which is being shown in the figure over here, 500 number of cases, let's say a city has 500 cases in the beginning. So if 500 cases were there, some of these cases of suddenly reach into the infectious stage. So in the initial period, when the number of infected cases are increasing, we don't have the recovery in the beginning. So our healthcare, whether it's failing or whether it's good, you don't have a recovery in the beginning. When we talk about COVID-19, the number or the figure of COVID-19 is that it takes some time for the recovery based on whatever the solution they are using, whether it's plasma therapy, whether it's hydrochloroquine, or whatever kind of vaccination trials each country are using in terms of solution. It's depending upon that. Somehow people are getting recovered. So those recovered cases are gonna be happening over some course of action. What every country is supposed to do is they need to make sure that the infected number of people doesn't become so high that you suddenly your healthcare system is not able to cope up with the number of that. And over the period of time, when you improve your healthcare capability, the recovered person will start increasing, and a time will happen at which this recovered people will be almost equivalent to the infected person, and at that stage recovered person are all will go up, and the number of active cases with the infected cases will go down. If we talk it with respect to the mathematical solution, ds upon dt, this is I already informed that s into I, the multiple of susceptible with the infectious people, and with a proportionality constant of a. So if we take at time t equals to 0, this is somewhere around a s naught I naught minus b I naught, the solution of the equation. And taking I naught as multiplication, a common factor is a s naught minus b. At time t at equals to 0, this number must be less than 0, because of which susceptible people are decreasing and infection people are increasing. I'm sorry, I have written it wrong over here. This should be this should be di upon dt. This should be reflecting di upon dt. So at time I equals to 0, infectious people are increasing. So a s naught minus I naught minus b I naught equals to is lesser than 0. And if we take the proportionality factor out, this number a s naught minus b should be less than 0, since I naught is never 0. When we have considered that even if there is a one person who is infectious, it cannot be 0, which obviously means your figure estimate a s naught minus b is taken as a comparative analysis, and we get a factor which is termed as r naught, a reproductive rate of this disease, how many people one infectious person is going to impact to other. A s naught upon b. A over here can be decreased if you maintain social distancing, if you take care of health and hygiene, you wear mask, you don't you use you wash your hand regularly and do all kind of things which are suggested by WHO. It doesn't spread the pandemic. And then S naught is the number in the initial sample. So if malls are open, if theaters are open, if industry is open, there is chance that more number of people could be reaching into this R naught part. So if we go into lockdown, there would be less people who are going to be impacted, and the solution is going to be that a s naught would be low and reproductive rate of this disease would be low. And ultimately the solution of this IT comes as e a s naught exponential of a s naught minus b multiplied by t. There are some good reference SIR model available on the MathWorks file exchange. I have already shared the link on the presentation, which you can download through the website. And I'll show you the third part in my system for the forecasting reference. So this observation they have created, I haven't changed anything in this code. I'm running as it is, ditto what they have done. And we haven't used this code in our work also. The reason why we are sharing others' work or showing this thing is because they have done really a good job. And we feel like this is something will be useful for you to watch and learn from it. We plan to create a very simple SIR model in the future. However, for the beginning part, for the initial part, this for the people who are still working on this SIR model can take this as a reference and create model out of this. How this number is happening and how future prediction is happening, on which date what is going to happen can be utilized through this. There is another model which is called as SEIR model, which is adding one more element into this, which is adding exposed. Susceptible people, all of the susceptible people are not always exposed. So initially, some of the infectious people are impacting the exposed people. This is actually creating equation in terms of one added factor, and I cannot actually, this is increasing the complexity and I don't want to include it right now. And we plan to add more videos in the future about this coronavirus epidemic, where we will be explaining about each of these model along with this, how you can solve this equation into MATLAB. You can use this epidemic model by E. Chenet for the reference, and I would show you this as well for the reference. So if you observe this part, you will be seeing the SEIR model, exactly what they have implemented with the quarantine, recovery, dead, and different kind of things. I'm not again explaining this thing in this webinar part, but this is something which you can check and review for yourself. This is very an interesting number to review. Ultimately, at the end of this session, what I would like to acknowledge that we have used COVID-19 data from various sources, and we acknowledge the different sources from ECDC, COVID-19, and even we have simply mentioned wherever the medias are used, even in this presentation. If something has been missed, it might be due to, it might have been ignored, but we do wish to add every resource which we have used publicly available. We have shared links to download our as well as others' work from MathWorks File Exchange, which is owned by respective creator. We haven't used any work of others in the COVID-19 tracker implementation. The purpose of this presentation is to spread awareness of COVID-19 as well as MATLAB. Ultimately, what I wish for everyone is you take care and stay safe. I'm open to take any question. If anyone have any query, they can simply post it in the YouTube comment section. I'll wait for your queries, and in the meantime, for the people who have joined the webinar video late, they can simply go to the live COVID-19. This link has been shown, and you can post your queries on the website discussion section, and we will try to take up your queries over there as well.